So, hello everyone. Today I'm gonna start the next part of the bones and joints of the thorax. Previously, I have told about the bones and joints of the thorax of typical ribs. Now, I would tell about the bones and joints of the thorax of the atypical ribs. In atypical ribs, the rib number first, second, 10th, 11th, and 12th. It is include. First, we would see the ossification of atypical rib. The typical atypical rib ossifies in the cartilage form. There are like two centers, one primary and three secondary centers. In one primary centers, it is near the angle, and about 8th week of the intrauterine life, this ossification takes place. And in like three secondary centers, one for head and two for tubercles. Now, the first rib is, there are four different categories in which the first rib we are going to study. The first is the identification, then side determination, features of the ribs, and attachment and relations. So, how to identify the first rib? It is the shortest, broadest, most curved, shaft is not twisted, no costal groove. Now, second is the side determination. In side determination, the anterior end is large. Okay. This is the anterior end. It is large, and the posterior end is the small and round. The outer border is convex and not having costal groove. The outer border is convex and it doesn't have any costal groove. Okay. The upper shaft, the upper surface of the shaft. Now, this is the shaft portion. Oops, sorry. This is the shaft portion. Now, its upper part of the shaft is crossed obliquely by two shallow grooves. Like, see here, this is the first groove and this is the second groove. There are two shallow grooves which is separated by a ridge. See, it is separated by a ridge. The ridge is enlarged at the inner border of the rib to form a scalenus tubercle. Now, from inner side, let me clear out this. From the inner side, see, this is the tubercle which is formed near the ridge, which is called as scalenus tubercle. Okay. Now, if we place the rib in a horizontal plane with a superior surface facing upward, both the ends of the rib touches the surface. Like, if you see different kinds of rib, first to 12th, there would be variations like the anterior end and the posterior end. The anterior end and the posterior end, one of the end would join the, would touch the ground, and one of the would be floating, kind of not balanced. But this rib, first rib, it would completely, both the points would touch the ground. Now, next is the features of the ribs. Now, in the features of the ribs, we need to know is, anterior end is large and thick than that in the other ribs. Like in other ribs, anterior end is not as much as large in the first rib, and it is continuous with the first costal cartilage. Okay, the anterior end, this end is large. This is the clavicle, this, not this part, no, this part. It is large, this is the anterior part, and it is large than the other ribs. The posterior end comprises the following. Now, the posterior end have many different kind of namings because of its shape. We have seen in the typical also. Now, which are those parts in the posterior end? This is the posterior end of the rib. Now, the head is small and rounded. See, this is the head which is attached to the thoracic body, T1 body of the thoracic vertebrae. And it is rounded also and articulates with the body of the first thoracic vertebrae. Neck is round and directed laterally upward and backward. This is the neck. The neck is rounded and directed laterally upward and backward. Okay. There is a tubercle. That tubercle is large and coincides with the angle of the rib. Now this tubercle is large and coincides with the angle of the rib. It articulates with the transverse process of the first thoracic vertebrae to form the costo-transverse joint. See this tubercle, okay, it is large and coincides with the angle of the rib, okay, and articulates with the transverse process. See, wait. This tubercle is attaching with the transverse process of the first thoracic vertebrae to form the costo-transverse joint. Now the shaft. We would study about the shaft. The shaft is also called as body and has two surfaces. It has the upper surface. It has two surfaces, which is upper and lower, and two borders, which is outer and inner. Okay. The upper surface is marked by two shallow grooves separated near the inner border by scalena tubercle. See, this is the grooves, just separated by a ridge, and it has a tubercle called as scalena tubercle. Now the lower surface is smooth and has no costal groove. Lower surface we cannot see from here, but it is smooth and has no any costal groove. The outer border is convex, thick behind and thin in front. Like this is the outer border. Okay, it is thick behind. It is thick behind and thin front. Okay, and inner border is concave. This is the inner border, which is concave. Okay, this was about the features of the first rib. Now attachments and relations. In attachments and relations, anteriorly the neck is related from the medial to lateral side. See, from the this is the neck region. Okay, from the medial to the lateral side there is a sympathetic chain. Okay, from the medial to the lateral side there is a sympathetic chain. Okay, I will show it to you. See, here there is a sympathetic chain. Okay, the posterior intercostal vein. Besides to that is the posterior intercostal vein. Besides the sympathetic chain near the neck, there is a posterior intercostal vein. Then superior intercostal artery. Besides that, there is a superior intercostal artery here. Okay. Now, next is the ventral ramus of the first thoracic nerve. Ventral ramus of the first thoracic nerve is here. It comes from the brachial trunk of the brachial plexus. Okay, wait a minute. Near the neck was what? Sympathetic chain, posterior intercostal vein and superior intercostal artery. Now, the superior ramus of the first thoracic nerve. It comes from ventral ramus of the first thoracic nerve. It comes from the brachial plexus and it comes like this. Okay. And also ventral ramus of the cervical C8 comes like this. Okay, from the brachial plexus. Now superiorly the neck is related to superiorly the neck is related to the deep cervical vessels and 8th cervical nerve. Now the anterior groove on the superior surface of the shaft lodges the subclavian vein. See here, anterior groove. This is the subclavian vein. The anterior groove on the superior surface of the shaft lodges the subclavian vein, and posterior groove lodges the subclavian artery and lower part of the brachial plexus. See, on the anterior groove is the subclavian vein. It is anterior groove, and on the posterior groove lodges the subclavian artery and the brachial plexus. Now the structures attached to the upper surface of the shaft. There is a subclavius muscle. Subclavius muscle is attached to the anterior end of the shaft. See, this is the clavicle, and near where the costal cartilage and the clavicle is attached here somewhere. See, if this is here is the costal cartilage behind the clavicle, then here is the subclavius muscle. The attachment of the costoclavicular ligament at the anterior end behind the subclavius. Now, see, here is the costal cartilage and here is the first rib. Then obviously there would be a ligament which is costoclavicular ligament. And near the costoclavicular ligament, there is a subclavius muscle. Now, insertion of the scalenus anterior on the scalene tubercle. See, here it was a scalene tubercle. There is the muscle attachment of scalenus anterior. And insertion of the scalenus medius is on the elongated rough area behind the groove of the subclavian artery. Now, see, here is the subclavian artery. From this side also it would be there. Okay. Now, scalenus medius is behind the groove of the subclavian artery. This is the groove of the subclavian artery. Behind that there is a scalenus medius muscle. Now the lower surface of the shaft. Now the lower surface of the shaft is covered by costal pleura and is related near its outer border of the small first intercostal nerve, which is very small. Now there are other muscles also which are attached to the outer border, which gives the origin for those muscles. Those muscles are external intercostal muscles on the outer border. Okay, outer border of the rib, there is an attachment of the external intercostal muscles and upper part of the first digitations of the serratus anterior. Now serratus anterior muscle is there. Its upper part of the digitation is attached behind the groove of the subclavian artery. Now behind the groove of the subclavian artery there is one more muscle which is on the shaft, is scalenus medius, and on the border there is a muscle which is called serratus anterior. Then thick portion of the outer border is covered by the scalenus posterior. Thick portion means which? Anterior side of the outer border. Which muscle is there? Scalenus posterior. Now on the inner border of the rib, it gives to the attachment of the suprapleural membrane. We have studied in the first cell video itself that suprapleural membrane makes the differentiation between the neck region and the thorax region. So on the inner side of the first rib, there is the attachment of suprapleural membrane. And the tubercle gives attachment to the lateral costotransverse ligament. Obviously, it is this tubercle is making attachment with the transverse process. Then there would be a ligament which is called costotransverse ligament. Now we would move towards the second rib. Second rib has its feature and attachment. Like we have studied about the first rib now, everything which is how to identify the rib, site determination, features of the first rib, and attachment and relations. So keep in mind, because it is very important to study the first rib. First, or not only the first rib, all the ribs, but there are many things in the first rib, so it is important. Now the second rib. Second rib features are, it is lengthy and twice that of the first rib. Now for making a comparison, I have kept both the diagrams here, the first rib and the second rib also. See, it is lengthy and it is twice as the length of the first rib. The shaft of the second rib is curved like that of the first rib, which is it is sharply curved as that of the first rib. See, it is completely curved. As you would see gradually, the other ribs, it won't be curved as this much which you have seen in the first rib and the second rib. Now the next point is, the non-articular part of the tubercle is small. See, this is the tubercle of the second rib, and see the tubercle of the first rib. The first rib tubercle attached with the transverse process of the T1 vertebrae, and the second tubercle is non-articular part, so it is a small. The angle is slight and is situated close to the tubercle. See, this is the Now the shaft, it has a no twist. Shaft is sharply curved, and it has also no twist. The outer surface is convex and faces more upward than outward. See, first rib, it was convex, okay, and this second rib, it is convex, but it faces outward rather than upward. Sorry, I said it opposite. The outer surface is convex and faces more upward than outward. Okay, it is upward rather than outward. Now the next point is, see, near the middle of this shaft there is a large tubercle. Okay, here. Okay, there is a large tubercle. This tubercle is a unique feature of the second rib. You should keep the all the important things which is unique in the ribs part, so it won't be difficult to identify. The inner surface of the shaft is smooth and concave as usual for the first rib also. It faces more downward than inward. Obviously, if the outer surface of the shaft is facing more upward than outward, then inner surface would face more downward than inward. Now there is a short costal groove on the posterior part of the surface. There is a short costal groove on the posterior part. See, this is the posterior part. There is a short groove. Okay. Now, what are the attachments to the second rib? The rough tubercle, which I said, which is the largest and which is the determining factor for the second rib. On that rough tubercle, it gives origin to 1.5 digitations of the serratus anterior muscle. It gives origin of serratus anterior muscle, and the rough part of the upper border receives the insertion of the scalenus posterior muscle. And I told you on the rough border groove, it gives the insertion of the posterior scalenus muscle. Till here it was about the second rib. Second rib is not that much as large as the first rib, but the differentiation you must know. Now we would move towards the 10th rib. 10th rib is not as that much big. It is closely resembles a typical rib, but is short and has only single facet of the head for the body of the 10th thoracic vertebrae. Now we would move towards the 11th and 12th rib, which is the last of the typical rib. In the 11th and 12th rib, these are the short, they have pointed ends. You can see here in this diagram, see, it have pointed ends. Okay, and the neck and tubercle are absent. The angle and costal groups are poorly marked in the 11th rib and are absent in the 12th rib. What is absent in the 11th rib? The costal angle and the costal groups. In the 12th rib, angle and costal grooves are absent, and neck and tubercle are absent in both the ribs. In the both the ribs, neck and tubercle both are absent. Now moving towards the next point, attachment and relations of the 12th rib. See, the capsular and radiate ligaments are attached to the head of the ribs. Now in the 12th rib, there are two ligaments which is attached to the head, which is called as capsular and radiate ligaments. To the head, capsular and radiate ligament. Now next, the followings which I am going to tell now, these are attached to the inner surface of the 12th rib. Now towards the inner surface, first one is the muscle attachment, which is quadratus lumborum, is inserted on the lower part of the medial half of the 2/3 of the surface. Now see, this is the lower half, okay, medial 2/3 of the inner surface. This green color, light green, is the quadratus lumborum, okay, and below this, the fascia covering the quadratus lumborum is also attached to this part of the rib, okay. This is the fascia, green color, and below this there is a muscle of quadratus lumborum, okay. This green color is the fascia of the quadratus lumborum, and in this gap there is a muscle attachment. Now internal intercostal muscle is inserted near the upper border. Now the internal intercostal muscle is attached here in the upper border. This is internal intercostal muscle, okay. Now costodiaphragmatic recess of the pleura is related to the medial 3/4 of the costal surface. Now this is very important one. The costodiaphragmatic recess of the pleura is related to the medial 3/4 of the costal surface. See this area which is I have marked with the dotted line. This area is called as costovertebral angle or costodiaphragmatic recess. Now we would see the following attachment of the outer surface. The attachment on the middle half. On attachment of the middle half, there is a costotransverse ligament. See, this is the costotransverse ligament. Costotransverse ligament. And lumbocostal ligament is attached. This is the costotransverse ligament, and this is lumbocostal ligament, okay. The next is the lowest levator cost. See this one. Okay, the iliocostalis and longissimus part of the sacrospinalis. This is the longissimus part. And iliocostalis in front. Now next attachment on the lateral half is the insertion of the serratus posterior inferior. See this one is the serratus posterior inferior. Serratus posterior inferior. The origin of latissimus dorsi muscle is here. Origin of latissimus dorsi muscle. I have posted a latissimus dorsi muscle on the YouTube. You can go and see the origin and insertion of those muscles. And also trapezius muscles I have done, rhomboid major and minor muscle. Every day I would post each muscles, which is the back, all the back muscles. upper limb, lower limb, all the muscles I would post it. I'm doing it only one each muscle because later it won't be like remembering, or might be difficult to remember. So if each day, if one muscle is done, it's easy to remember also. So next is in this, origin of the external oblique muscle of abdomen. Here below, it is the origin of external oblique muscle. Okay. Now, next is the intercostal muscles are attached on the upper border. On the upper border, the intercostal muscles are attached. And here there is a structure attached on the lower border is middle layer of the thoracolumbar fascia. This dotted line of the green color I have marked here. This is middle layer of thoracolumbar fascia. Okay, till here it was all the typical ribs which I have told, first rib, second, 10th, 11th, and 12th. So please do remember all the things which is needed, the size of the ribs, the grooves of the ribs, the tubercle, the different muscles which are attached. It is important. This video is till here only. The next video would be the ossification of the costal cartilage, then sternum, and all those parts I would start about the thorax. Okay, thank you. Bye bye.